Assalamu alaikum. I am Dr. Mohammad Hassan Jafri. Completed my MBBS from Dhaka Medical College. So today I am going to tell about something about ECG, that is the conduction system of the heart, and some basic principles of ECG. So at first we are talking about the conduction system of the heart. At first there is SA node or sinuatrial node, then three internodal pathways, then the AV node or atrioventricular node, then the bundle of keys, then right bundle branch and left bundle branch, which are further divided. Left bundle branch is further divided into anterior fascicle and posterior fascicle, and these two fascicles and right bundle branch is further divided into Purkinje fibers, which are associated with the ventricles of the heart. So now, how the conduction is passed throughout the heart? At first, the stimulus is generated in the sinuatrial node, then through the three internodal pathways it comes to the AV node, then in the bundle of keys. Bundle of keys is situated in the interventricular septum. In the interventricular septum, the conduction is passed from the left to right. Then through the left and right bundle branches, the conduction is passed towards the cardiac muscle. And the first area to be depolarized in the ventricle is anteroseptal region in the ventricle, and the last region to be depolarized is the posterobasal region of the heart and the pulmonary cones. Now we will discuss some basics about the ECG. So how the positive and negative waves in the ECG are formed. Suppose a conduction is passing from this point to this point, and we are placing ECG leads in different parts of this conduction. So if we place an ECG lead here in my mouse pointer, so the conduction is passing away from this lead. So we will see here a negative deflection. And if we place the lead here, the conduction is passing towards the lead, so we can see a positive deflection. And if we place the lead here, that is in the middle of the conduction, see it's like a Doppler effect. That is, uh, when the impulse is passing towards that lead, we can see a positive deflection. But when this conduction is passing away from the lead, then we can find a negative deflection. So here we can find both positive and negative deflections. Now let's see the ECG leads. I want to show you a diagram first. There are 12 ECG leads, 6 limb leads and 6 chest leads. So chest leads, we all know that V1 to V6, and 6 limb leads. Among them, we can divide into unipolar leads and bipolar leads. Unipolar leads are AVR, AVL, AVO, and bipolar leads are 1 to 3. Here, A means augmented, V means ventricular, R means right, L means left, and F means foot. So here comes the picture. It is the right arm, and here the AVR is situated. Here the left arm, here the AVL is situated, and it is the left lower limb. Here the AVF is situated. So if we draw a triangle here in between these points, this triangle would be like this, like this. Okay, so um, we are we are using the left lower limb because the actual direction of the heart is towards the left. The apex of the heart is towards the left. So if we want to include the apex of the heart in this triangle, we have to use left-sidedly. So this triangle is called ignorance triangle, and the heart is situated inside this ignorance triangle. And 1 to 3, the leads 1 to 3 is here. The lead 1 is from the right turn lead to the left turn lead, that is from AVR to AVL. Lead 2 is from AVR to AVR, and lead 3 is from AVL to AVL. So we can see here that lead 1 is horizontal, lead 2 is according to the uh, apex of the heart, and that is towards the apex of the heart according to the axis of the heart, and lead 3 is away from the axis of the heart. So now we can take a cross section of the heart here, and we can see the chest leads in the anterior chest wall. Here V1, V2, V3, V4, V5, and V6. So we can say that V1 and V2 is taking the picture, that is the electrical picture of the right ventricle. V3 and V4 is taking the electrical picture of the interventricular septum, and V5, V6 is taking the electrical picture of the left ventricle. Now, if we take a diagram here, lead 1 is horizontal, we have said it earlier. It is lead 2 actually, there is wrong here. Lead 2 is directed towards the axis of the heart, towards the apex of the heart. And this is lead 3, this is a mistake. Lead 3 is away from the axis of the heart. And AVR is obviously to the right, AVL is obviously to the left, and AVF is obviously the inferior, that is downwards. And here another picture of the chest leads. Here is another mistake, that V1, V2 is not septal. It is V1, V2 is mainly anterior portion of the heart. V3, V4 is the septal portion of the heart, and V5, V6 is the lateral portion of the heart. And we all know that lead 1 is horizontal and lead AVL is to the left. Lead 1 is also to the left, so they are called high lateral. AVR is to the right. Actually, in the anatomical position of the heart, it denotes the posterior portion of the heart. And lead 2, 3 AVF, we all know that 2 is like this, 3 is like this direction, and AVF is like this direction. So these 3 are inferior leads of the heart. Now the placements of the leads, it's like the camera. So AVR is in the right wrist, AVR lead is worn in the right wrist, AVL is in the left wrist, and AVF is in the left lower limb. And there is also another lead in the right limb. It is called the earthing lead. It does not have any impact on the ECG waves. So here the positions of the chest leads, that is V1. V1 is situated in the fourth intercostal space in the right sternal border. V2 is also in the fourth intercostal space in the left sternal border. V3, there is also another mistake. V3 is in the mid-clavicular line in the fifth intercostal space. V5 is in the anterior axillary line in the fifth intercostal space, and V4 is situated in between V3 and V5. V6 is also in the left uh, fifth intercostal space, but in the mid-axillary line. Now some ECG morphologies. Suppose this is an ECG paper, and 25 millimeter per second is the rate of conduction of that ECG paper. So 1, 2, 3, 4, 5. These 25 small squares, 25 millimeters, are passed in 1 second. Now, these 25 small squares, let's see a small square individually. This is a small square. So, 25 millimeter per second, that means this small square, this one length is 0.04 second. And a large square which consists of 5 small square in each side. So one length of the large square is 0.04 into 5, that is 0.2 second. It is in the x-axis. And in the y-axis, 1 millimeter denotes, 1 millimeter means one small square, one length of one small square denotes 1 millivolt. So 5 millimeter means 5 millivolt. Now the waves of the ECG, we all know that there are certain waves of ECG, P wave, then a Q, R, S, and a T wave. QRS is collectively known as QRS complex. P wave denotes atrial depolarization, QRS denotes ventricular depolarization, and T wave denotes ventricular repolarization. Here we can see that atrial repolarization has no individual wave. It is intermingled here in the ventricular depolarization waves. And there are also many segments and intervals in this ECG wave. Segments denote a length which is an end from an end of a wave to the beginning of it. And interval is the length which is situated from the beginning of the wave to the beginning of another wave. So let's see another picture here about the segments and the intervals. This is PR segment, that is this portion from end of the P to the beginning of the Q is called PR segment. This is called ST segment from the ending of the QRS to the beginning of the T. It's very much important. I will discuss it later. And these are intervals. PR intervals is from the beginning of the P wave to the beginning of the QRS complex. QT interval from the beginning of the QRS complex to the end of the T wave. So here in this picture we are seeing another wave, that is U wave. I will discuss it later during discussion of waves individually. So now let's come to the previous picture. We have shown the waves, intervals and segments. Now how the QRS complexes are named. R is always the positive reflection of the QRS complex. Before R, if there is any negative reflection, this is called Q wave. After R, if there is any negative deflection, this is called S. So QRS is named like this. If there is another positive deflection other than R, this is called R prime. So now another term here, that is the R wave progression from the V1 to V6, that is in the chest leads. In V1, we see that positive deflection is less, but negative deflection is more. But when we go through V2, V3, V4, V5, and lastly V6, here we can see that positive deflection is more and negative deflection is less, because we have shown that V1 is situated in the right side of the heart and V6 is situated in the left side of the heart, and the heart anatomically lies in the left side of the body. Its apex and its direction, its axis is always to the left side of the body. So if we see the picture here, that here is the heart which is situated in the left side, which apex is directed to the left and its direction, its axis is directed to the left. So its impulse also directed to the left. That means directed to V6 more than V1. So when an impulse passes from this side to this side, it actually passes towards the V6 away from the V1. So in V6 we will see more positive deflection, and in V1 we will see less positive deflection. Actually, I have described it earlier in this picture, that towards the lead positive, away from the lead we can see negative. So towards V6 more positive, away from the V1 more negative. This is actually called the progression of the R wave, and it is also very important in clinical practices. I will show you in the future lectures. So this is today's topic. Hope you have enjoyed. I have used the book. The name of the book is Learn ECG in 100 Days. Hope in future I will tell some more topics from this book or any other book regarding ECG. Hope you have enjoyed the session. Thank you.